if you went to get a new pair of eyeglasses, you would expect that it was made for you and not some generic prescription. Precision medicine is to use everything that you have access to about the individual to optimize the recommendations for their health maintenance or the treatment of a disease if they develop one. It is the antithesis of one-size-fits-all medicine, which has been the way we have largely had to operate because it was the best we could do. Most of the time, if you went to your doctor, you got a generic recommendation based on the expectation of you as an average patient. But none of us are all that average. Precision medicine tries to build on an advent of a lot of technologies that have come along to do a better job, to take full advantage of genomics, including perhaps your entire DNA sequence, which is increasingly cheap, down to a couple $1,000s now, as well as your detailed environmental exposures, your family history, your own health practices, your previous medical experience. Your electronic health record is a window into lots of other things. Putting that all together and then trying to take that individual and make a recommendation that fits them. That's what precision medicine aims to do. You know, let's be fair. We've been doing this in certain spaces in medicine. If you went to get a new pair of eyeglasses, you would expect that it was made for you and not some generic prescription. If you got a blood transfusion, you would expect it would have been typed and crossed and it would be designed for your blood type. But you know, you get too far outside those examples and you're pretty quickly into generic territory. I mean, take drug prescribing. We know that people's metabolism of drugs varies. We even know why in many instances, but we don't use that information. Usually it's like, okay, you're going to get the dose of the drug that works for most people. For you, it might be too much or too little, or you might have a terrible toxic side effect. We could do better in predicting that. We actually are developing the kind of information that would change that. We just haven't figured out how to implement it.